Hi and Assalamualaikum everyone. My name is Muna Izzah and together with my teammates Lisa Royhana, Aisha Fika and Nur Nadira, we will be presenting on the topic IoT application in pacemaker system. In this presentation, we will share how IoT technology is used in pacemaker to improve heart health monitoring. Every year, millions of people with heart problems depends on pacemaker to keep them alive. But how can doctors keep track of their heart condition every moment? That's where the Internet of Things, which is IoT, they be able to send real-time health updates straight to the doctor.
My name is Angelika. Today I would like to tell you what is a pacemaker. A pacemaker is a small battery-powered device that prevents the heart from beating too slowly. You need a surgery to get a pacemaker. The device is placed under the skin near the collarbone. Next, types of pacemaker. The first one is single-chamber pacemaker. This type usually sends electrical signals to the lower right chamber of the heart. Next, dual-chamber pacemaker. This type sends electrical signals to the upper and the lower right heart chambers. And the last one is biventricular pacemaker. This type also is called a cardiac resynchronization pacemaker. It's for people who has heart failure and a slow heartbeat. The device simulates both lower heart chambers. It helps make the heart muscle stronger. So here's the pacemaker. The first one is traditional pacemaker and the second one is modern pacemaker. For the traditional pacemaker, for the size and shape, relatively large device usually implanted under the chest skin with wires, so that is connect to the heart. For the components is pulse generator and leads. For the function, sends electrical impulses when the heart beats too slowly. And the technology is very often respond only to slow heart rates. And program is settings are adjusted externally by doctor using a programmer. So the battery life is typically 5 until 10 years. So let's move to modern pacemaker. For size and shape, much smaller. Some are the size of large vitamin capsule, so it can be implanted directly inside the heart. For the function, treats slow heart rates. Newer models support dual chamber pacing and more complex rhythms. For the technology, wireless communication, and it can be linked to smartphone or remote monitoring system. So for the battery life, typically lasts 10 to 12 years.
My name is Nur Nadira and I will be presenting about collection phase in pacemaker context. First, I will explain about pre-implantation. Pre-implantation is before surgery. So before a pacemaker is implanted, doctors must carefully collect information to confirm that the device is truly necessary. This process ensures that symptoms are not caused by another condition that can be treated differently. First, patient history. The doctor first asks about the patient's medical history and symptoms. Common signs of an abnormal heartbeat include fainting spells, extreme fatigue, dizziness, and episode of heart palpitation. These symptoms help the doctor understand how the irregular heartbeat is affecting the patient's daily life. Second is physical examination. Next, a physical exam is performed. The doctor checks the patient's pulse to evaluate the heart rate, measures blood pressure, and listen to the heart sounds with a stethoscope. These simple steps can provide initial clues about the heart function. Third is diagnostic tests. To get a clear picture, several diagnostic tests are carried out. First, electrocardiogram, which is ECG. ECG records the heart's electrical activity to detect irregular rhythms. Second, Holter monitor. Holter monitor is a portable ECG device that records the heart rhythm continuously over 24 to 48 hours, helping to identify abnormalities that might not appear during a short ECG test. Third is echocardiogram. Echocardiogram uses ultrasound to visualize the heart structure and pumping ability, showing whether the heart is functioning effectively. Next is blood test. Blood test is performed to rule out other possible cause of symptoms such as thyroid disorders or imbalance in electrolytes like potassium and calcium, which can also affect heart rhythm. The purpose of the pre-implantation or collection phase is to confirm whether the patient's slow or irregular heartbeat is truly severe enough to require a pacemaker. By gathering detailed history, examination findings, and test results, doctor can make an accurate decision and avoid unnecessary surgery. Next is implantation. Implantation is during surgery. Once the decision to implant a pacemaker has been made, the next important step is the surgical procedure itself. During surgery, doctors not only place the device but also collect critical device-related data to make sure the pacemaker will function properly inside the patient's body. First is lead testing. After inserting the leads, which is wires, into the heart, doctors test their performance. This involves measuring capture threshold, which is the minimum amount of electrical energy needed to make the heart contract. Second is impedance, which is the resistance in the pacing circuit, which helps confirm that the lead is intact and not damaged. After that is sensing values, which is the ability of the pacemaker to detect the heart's natural electrical signals. These tests ensure that the leads are working efficiently and are in a good contact with the heart tissue. Second is imaging data, which is X-ray or fluoroscopy. Real-time imaging, usually with fluoroscopy, a continuous X-ray, is used to guide and confirm the exact placement of the lead in the heart. This step is crucial because improper positioning could result in ineffective pacing or complications. Next is programming settings. Before completing the surgery, the pacemaker is programmed according to the patient's specific needs. This includes pacing mode, which is determining how the device delivers electrical impulse. Second is rate, settings the minimum heart rate that the pacemaker will maintain. After that is sensitivity, adjusting how well the pacemaker detects the patient's natural heart activity. The main goal of the implantation phase is to make sure that the pacemaker and its leads are positioned correctly, functioning properly, and programmed with the right settings. By collecting and analyzing this data during surgery, doctors can ensure that the device will support the patient's heart effectively before the operation is complete. After that is post-implantation. Post-implantation is after surgery. After the pacemaker has been carefully implanted, the process of data collection does not stop. Continuous follow-up is essential to ensure that the device is functioning correctly, that the patient is recovering well, and that any potential problems are identified early. Short long-term monitoring. In the days immediately following surgery, doctors and nurses carefully observe the patient for wound healing, making sure the incision site is clean and healing properly. Second is complications, watching for issues such as bleeding, infection or swelling. After that is lead dislodgement, ensuring the wires placed in the heart have not moved from their proper position. Second is long-term device data is interrogation. Over time, the pacemaker is checked regularly using a specialized programmer that communicates with the device. This process, called interrogation, provides detailed information such as battery life to estimate how long the device will continue to function before replacement is needed. Second is percentage of pacing, showing how often the pacemaker is supporting the heart compared to the heart's natural rhythm. After that is episode of arrhythmia, recording any abnormal heart rhythms detected by the device. And last is lead stability and function, is confirming that the wires remain in good condition and continue to work effectively. Last but not least is remote monitoring. Many modern pacemakers are equipped with wireless technology. This allows them to send daily or weekly reports directly to hospital systems without the patient needing to come in frequently. Remote monitoring makes it easier to track, change and identify problems quickly. The purpose of the post-implantation or follow-up phase is to verify that the pacemaker is functioning correctly, ensure the patient's symptoms are improving, and detect any issues as early as possible. Regular follow-up and data collection give both doctors and patients confidence that the device is working safely and effectively. After that is collection phase in research or clinical trials. Pacemakers are studied in research setting or clinical trials. The collection phase refers to the systematic gathering of data at different stages of the study. This ensures that researchers have enough information to evaluate how safe and effective the device is and how it compares with other treatment options. First is baseline patient data. Before the pacemaker procedure, researchers collect details about each participant. This usually include age, sex, medical history, and other health conditions, comorbidities. Gathering baseline data helps researchers understand the characteristics of the study population and identify any risk factors that may influence outcomes. Second is procedure data. During the implantation procedure, information is recorded about the type of pacemaker used, the duration of the surgery, and any complications that occur. These details help assess how safe and practical the procedure is under real clinical conditions. Third is follow-up data. After the pacemaker is implanted, researchers track the patient's progress through regular follow-ups. This may involve recording hospitalizations, evaluating improvements in quality of life, and monitoring the device performance over time. Such data helps show whether the pacemaker is delivering real benefits to patients. Last but not least is outcome data. In the long term, researchers collect outcome data such as survival rates, overall effectiveness of the device in controlling abnormal heart rhythms, and any side effects or complications. These results are critical for determining whether the pacemaker provides lasting benefits and is safe for widespread use. The overall purpose of the collection phase in pacemaker research is to evaluate the safety, effectiveness and reliability of the device, as well as to compare it with other available treatments. By systematically collecting and analyzing this data, researchers can provide evidence-based to improve patient care and future device development. Last but not least is why collection phase is important. The collection phase is one of the most critical steps in pacemaker care and research because it provides that information need to make safe, effective and evidence-based decisions. First is accurate diagnosis. By carefully gathering patient symptoms, medical history and test results, doctors can confirm whether a pacemaker is truly necessary. This prevents unnecessary surgery and ensures that only patients who really need the device receive it. Second is patient safety. During implantation, collecting data such as lead measurements, imaging results, and device setting helps doctors avoid complications and make sure the procedure is performed safely. This step minimize risk like infection, bleeding or device malfunction. Next is the device performance. Testing and programming the pacemaker during and after surgery ensures it is working correctly. Collecting this information allows the device to be fine-tuned so that it meets the patient individual needs. After that is long-term monitoring. Even after implantation, continuous data collection through follow-up visits and remote monitoring is essential. It allows doctors to detect problems early, track the device battery life, and confirm that the patient's heart is responding well. This leads to better long-term outcomes and quality of life. But not least is research and innovation. In clinical trials, systematic data collection builds the scientific evidence needed to improve existing pacemakers and develop new ones. This research ensures that future patients receive safer, more effective and more advanced devices. In simple words, the collection phase for a pacemaker is the information gathering stage. Doctors or researchers collect patient details, test results and device data before and after surgery. This process makes sure that treatment is necessary, safe and effective while also helping improve pacemaker technology for the future.
Next is communication phase. For the first one is communication method. For the pacemaker tradition is one base telemetry, requires close contact usually via inductive call, but for the pacemaker modern is wireless communication, radio frequency, Bluetooth or near field. Next is data transfer. For pacemaker traditionals is only during in-clinics visits using a specialized programmer, but for the pacemaker modern, remote data transfer to clinicians via home monitoring system, often daily or as needed. The third one is remote monitoring. For pacemaker traditional is not available or very limited, but for the pacemaker modern is standard with real-time data streaming. Next, sensing response. For pacemaker traditional is basic sensing and fixed pacing, but for the pacemaker modern is adaptive, intelligent pacing algorithms. Next is data security. Pacemaker traditional is low, but the pacemaker modern is high. Last but not least, for interaction with clinicians. For pacemaker traditional is manually integration by doctor using wand, but for the pacemaker modern is automatic or on-demand data syncs to secure cloud platforms accessible to tech care teams. And the last one is alerting system. For pacemaker traditional is patient must report the symptoms, but for the pacemaker modern is automatic alerts sent to providers for other remains, battery issues or lead multifunction.
The analysis phase in a pacemaker IoT system is the brain of the whole process. It takes the raw data collected by the pacemaker sensors such as heart rate, ECG signals, and other vital information, and it will turn it into meaningful insight. Without this phase, the data would just be numbers with no clear story. But through analysis, the system can identify health problems early before they become emergencies, provide continuous and real-time monitoring without frequent hospital visits, detect dangerous heart patterns such as drops in heart rate, and using advanced algorithm and AI, deliver clear reports and instant alerts to doctor and patient. Right, so we'll move to the process of analysis phase. The process begins with data from the pacemaker. This device continuously collects important information such as heart rate and ECG signals from the patient. Next, we have data filtering and cleaning. This step removes noise or error from raw data, so the information we analyze is accurate and reliable. After that, we move to data analysis. Here, the system studies the patient's heart rate and ECG patterns carefully to understand how well the heart is working. Then comes to pattern detection. The system uses smart algorithm to decide whether the rhythm is normal or abnormal. If anything unusual is detected, it is flagged immediately. Finally, we have the alert and report stage. If the system finds a problem, it will instantly send a notification to both the doctor and the patient. This ensures that medical attention can be provided quickly if needed. So here we can see flow chart of analysis phase. We start from data from pacemaker and then data filtering and cleaning, data analysis, pattern detection, which is the rhythm is normal or abnormal, alert or report stage to doctor and patient. And then we'll move to the next slide, heart pattern. This graph represents the pacemaker cell cycle. It shows how the electrical activity pacemaker cells in the heart change over time. On the vertical axis, we have the membrane voltage in millivolts. On the horizontal axis, we have time. There are three key phases. Phase 4, slow depolarization. The voltage gradually rises from around negative 70 millivolts towards the threshold. This prepares the heart for the next beat. Phase 0, depolarization. When the threshold is reached, calcium ion flow into a cell, causing a rapid rise in voltage. This spike triggers the heartbeat. Phase 3, repolarization. What is repolarization? Repolarization means the process where the heart cell returns to its resting state after a heartbeat. For the phase 3, repolarization, potassium ion flow out, the voltage drop, and the cell returns to its resting state and ready for the next cycle. By analyzing this pattern, we can detect abnormalities in the heart rhythm and use this information for medical decisions. So, overall, analysis phase ensures early detection, continuous and monitoring without frequent hospital visit, and accurate health reports for both patient and doctors.
So next we move into action phase. So pacemaker saves life by correcting heart rhythm issues with electrical signals that keep the heart beating at regular pace. So the action here is by sending electrical signals to the heart if it beats too slow or too fast, depending on the heart rhythm issues. So, as we all know, a sinoatrial node, or commonly known as SA node, is our heart's own natural pacemaker. It is located in the top right atrium of our heart, and it functions to generate electrical signals from the top of the heart to the bottom in a synchronized manner, leading to a heartbeat. But sometimes, some of us, our sinoatrial node doesn't function normally and needed a pacemaker. Hence, the heart rhythm issues. So the first one, we have bradycardia. Bradycardia is a condition where the heart beats abnormally slow, typically much less than 60 beats per minute and usually less than 40 beats per minute. It prevents the body from receiving enough oxygenated blood. Next, we have the heart block. Heart block occurs when the electrical signals that control heart rhythm are partially or completely blocked between the upper atrial and lower ventricle chambers of the heart. This disruption can cause the heart to beat too slowly or irregularly. After that, we have the sick sinus syndrome, also known as sinus node dysfunction. It is a group of heart rhythm problems caused by a malfunctioning in sinoatrial node. This condition can result in alternating episodes of bradycardia and tachycardia, as well as pauses in the heart rhythm. So next is the condition of a heart that can happen before birth, which is a defect in the structure of the heart. It can change the way blood flows through the heart. So last but not least, we have atrial fibrillation with slow ventricular response. It is characterized by rapid and chaotic electrical signals in the heart's upper chamber, causing them to quiver instead of beat effectively. So now that we have known some of the heart rhythm issues, all of it is related to one, which is either the heart rhythm is beating too fast or too slow, which require a pacemaker with its main function, which is to send electrical signals to the heart to make it beat regularly so that we can function throughout daily activities. Moving on, we have two types of pacemaker. The first one is the traditional transvenous pacemaker, and the second one is the modern leadless pacemaker. To start, a traditional transvenous pacemaker has three main parts. The first one, a pulse generator. A pulse generator is a small metal case that contains electronic circuitry with a small computer and a battery that regulate the impulses sent to the heart. Next is the wires or the leads, which is implanted inside the veins and carry the pulses to your heart. The lead is an insulated wire that is connected to the pulse generator on one end, with the other end placed inside one of the heart's chamber. Last but not least is the electrodes. The electrodes sense your natural heartbeat. The electrode on the end of a lead touches the heart wall. The lead delivers the electrical impulse to the heart. It also senses the heart's electrical activity and relays the information back to the pulse generator. After that, we move on to the modern leadless pacemaker. The modern leadless pacemaker contains a very small computer that is powered by a lithium battery. Also, all electronic components of leadless pacemaker are sealed inside a metal case that is made of titanium. To compare with the traditional transvenous pacemaker, leadless pacemaker has only one main part and is in the size of a pill. So, the pulse generator and electrodes are combined into a single device. The function is almost quite the same as the traditional pacemaker. It monitors the heart rhythm, and if it is too slow, it will send electrical impulse for the heart to contract and expand at a regular rate. There are two types of leadless pacemaker. The first one is Medtronic Micra. which is an earlier approved of leadless pacemaker. There are two types of leadless pacemaker. The first one is Medtronic Micra, which is an earlier approved leadless pacemaker but only supports right ventricular pacing only, while the Abbott Avere offers single chamber and dual chamber leadless device with a double helix design for the atrial device. As you can see in the photos attached, Avere's leadless pacemaker has three positions. The first one is located in the right atrium of the heart. The second one is located in the right ventricle of the wall of the heart, and the third one is the dual chamber, which is located in the right atrium and also the right ventricle of the heart. So now that we have reached the end of the slide, these are the list of the references and also the citation of the link. Thank you for watching and have a great day.